All right, everyone, this is super interesting. The American Lung Association's annual State of Tobacco Control report was released yesterday. There's a lot included in it. So here to help us break it all down is Nick Torres, the Advocacy Director for the American Lung Association in Indiana. Nick, thanks so much for coming on.
Yeah.
So you're going to give us sort of like a Cliff Notes version of this, right? So first of all, what is this report?
Sure. Well, it's report card season for the Lung Association. Every January, we put out our State of Tobacco Control report.
We get a report card on that.
That's right.
Oh, that's interesting.
It's our 18th year doing it.
Oh, okay.
And so we look at each state as well as federal grades and check in with how we're doing on 5 key areas of tobacco control.
What are those areas?
Well, we look at cigarette taxes. We look at the level of funding for tobacco prevention and education in the state. We look at the age. So Tobacco 21 has been a big issue in the news recently. We look at access to cessation services, making sure people have access to the tools and the programs they need to be able to quit smoking.
Okay.
And then we look at the level of smoke-free air protections. So we know that protecting people from secondhand smoke in the workplace and around the state is really important too.
Sure. Okay. So what were some of the findings for this year?
Well, we've got a lot of work to do in Indiana. We got 4 Fs and 1 C.
Oh no!
Yeah.
4 Fs, you guys. 4 Fs. Okay. Is that better than previous years though? Are we doing a little bit better? Or are you? The look on his face is not good.
Well,
it's about the same.
We have a lot of work to do. It's about the same.
That's the positive way
But
to
I
see
think
it.
we're trending in the right direction.
Okay.
So we're poised, I think, this year to make some really big gains at the state level, raising the age of tobacco sales from 18 to 21, as well as putting in place some enforcement measures so that we hold retailers accountable for selling to underage kids. We know that e-cigarette use among youth has been skyrocketing recently. We're also looking at raising the cigarette tax next year. It's a big topic that the legislature has debated for the last few years.
Yeah.
And so I think if we make some key improvements in those areas and really put some funding into education and prevention, we'll make some gains on our grades.
We're seeing a difference with education and prevention. And so you're an advocate for all of that at the state level.
Right.
Okay.
We know that we have some key measures that if we can advance those, that the health of our state will improve greatly.
Absolutely. How does that play with cancer? Have you seen anything with lung cancer rates?
Well, awareness for lung cancer is getting better and better. And as smoking rates start to decline around the country, we're hopeful that those rates will continue to decline. We're making some big breakthroughs in lung cancer research in particular.
Okay.
And so we want to keep those gains moving, but we know that we have to keep that progress moving at the state level with some of these major issues and legislation.
And then do you compare to other states as well?
Right, yeah.
Okay.
So every state in the country gets grades, and we're a little behind our neighbors. For example, we have the lowest cigarette tax in our region right now.
Okay.
And so that's an easy way. If we raise that, we would start to see our grades rise.
Okay. Anything else people can take away this report? Like, how can we continue doing better on a personal level?
Well, I think awareness and education is a big one. We know that in particular with our youth, if we invest a little bit more in terms of education and prevention, that we can keep this next generation of kids from being addicted to tobacco products. And I think that will make a huge impact.
Yes, absolutely. Well, that was really interesting. Interesting about the grades. And then, like you said, you see all the ways that we can do better.
Absolutely.
So we appreciate your whole role and what you're doing to help our state and the health of it.
We've got to work it out for us, but we've got a lot of good people making sure that we're a healthier state.
It sounds like we do. Where can we get more information?
Well, on our website, lung.org, you can find our entire report and look at our grades and really dig into the areas that Indiana needs to make some improvements on.
Yeah, that's right, and help support everyone. All right, thank you so much, Nick.